Oh, whoa, wait. Is that a leg going flying? What is that? Restricted access, just hanging out, and a whole lot of missing parts. Today, we're heading to the abandoned toy factory, breaking down and reacting to all of these shocking medical scenes and frightening injuries from the highly popular horror video game, Poppy Playtime. Let's dive right in. Whoa, run away. All I can see is the hands, right? They're in an interesting position, so I'm assuming they're pushing. We actually do a neurologic test where we force somebody's hand like this, and then if they actually have this tick, it's called asteristics. Nice. Pretty smart. But imagine a massive, heavy box falling on you and your body just bends in half like that, so you snap your vertebrae in half. I've actually literally seen people snap their vertebrae, become paralyzed. Typically, they have to do with like falls from really great heights and landing on an uneven surface. Whoa, go, go, go. I've actually seen injuries come to the emergency department from these type of machines, like no joke. What ends up happening is somebody gets caught, maybe a piece of clothing, a piece of equipment, and I've seen people's hands get torn off or fingers ripped off. Oh, no. What have you done? I've never seen anybody die from this, thank goodness, but you have to be really careful with any heavy machinery. Should they have safety measures on there? Yeah, they probably have them, but stuff potentially could still happen. If you lose an appendage, something gets cut off or amputated off, bring it with you. This circumstance, there's nothing potentially to put back. Obviously, if this happens while you're at a job site, get the patient to safety first. Try to stop the bleeding, either tourniquet or a significant amount of pressure gauze to the area. Get the person to the closest emergency department. Interesting, they have like restricted access. If you guys ever walk around the hospital, you'll see signs everywhere that's like staff only, restricted access. It's actually quite interesting. Like I have a badge at the hospital that it's actually set up to only allow me in certain areas. Oh, whoa, wait. Is that a leg going flying? What is that? It looks like directly at the knee. We typically have AKA or a BKA. The knee is made up of your kneecap, proximal part of your tibia, and the distal part of your femur. Wow. Hanging by your wrists in that position can cause significant amount of pain, not only to the wrist, but to the shoulder joints, to the muscles of the chest and the rotator cuff of your shoulder. Oh. We do see this happen in the emergency department occasionally where blood just gets splattered everywhere, or even patients spitting, patients throwing poop, throwing urine, vomiting. There's a lot of different liquids that get thrown around that could end up on walls, the floor, on people. Whoa, we got some new hands. Cool. Say you have a prosthetic and have the ability to change out different types of prosthetics. I know individuals who say are runners, they have like a normal like leg prosthetic and then they have their running one. That's like the blade. I know people have probably seen those. As technology gets better moving forward in the future, there are a lot more options that are coming to fruition. And there could be a point where they have the ability to be controlled by your brain. Oh, we got some electrical energy. Injuries by electricity. Typically, the only time we see electrical type injuries, work sites or somebody's accidentally like hitting an outlet. Most of the time they're low energy and they don't cause significant amount of issues. Just like when the law enforcement uses, say, a taser or those barbs that shoot out and would tase somebody, that is typically within the soft tissue itself, not causing cardiac arrest or any long-term damage, more just causes incapacitation for a very short period of time and discomfort. When they do come to the emergency department, a lot of times those barbs are still stuck, so we have to remove those with force because they'll just come right out, or we have to actually cut them out. If somebody comes into the emergency department with an electrocution type injury, we also want to check to see if there's any breakdown of muscle tissue for rhabdomyolysis, checking out a CPK level. And then obviously we want to check their kidney function as well to make sure it's not getting clogged up due to muscle breakdown. We went from a shock to on fire to being burned. Electrical injuries could cause burns on the inside, but then you do have burn injuries that we do worry about outside of like 1st degree, 2nd degree, 3rd degree, 4th degree burns. You worry about when the burn is that bad that it's engulfing around the individual, that they're breathing in the flames, causing airway disruption, causing melting of the tissue, causing swelling of the tissue, and then taking the oxygen away so you actually can't breathe. Not so much. Whoa! Wow. This one was crazy. What crazy apparatus. It almost looks like Wolverine's claws. Stab right through. Maybe the head is where the motherboard is for these toys and creatures. But again, same thing for humans. But if you stab too low, if you're going through the mouth in a human, you're going more like brainstem and lower part and cerebellum versus like the higher functioning part of your brain, which is higher up in the dome up here. If you have an injury to the brainstem, that's where your autonomic nervous system helps to communicate to everything else, and you might not have function of your ability to breathe or have a heartbeat. We at the hospital do have devices to actually help lift patients, especially if they are a little bit too heavy for an individual lift, because then you don't want to increase the risk of hurting somebody else. If somebody, say, has dead weight, not that they're dead, but they don't have the power to help themselves to lift, that is heavy. Individuals anywhere between 100 to like 500 pounds, yes, you can really hurt yourself because they're also in a bed or in a chair and you're using abnormal mechanics to be able to help them up. So if somebody's trying to lift somebody up from their jaw with their hand in their mouth, would there be any injuries? Maybe some teeth coming out. The jaw would probably stay intact, especially the upper jaw, which is your maxilla, which is attached to your skull. Interesting game. It's kind of a little dark, but there are some medical injuries. We see some random blood. We see some toys that just almost seem possessed. Also, I made fast-acting health supplements with you in mind. No matter what the issue, I got you covered. Check out Life Happens. You take them only when you need them. If you guys like this and want me to do more, let me know. If there's any other games out there you want me to check out, definitely binge this playlist right here. Do me a favor, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.